Kia ora koutou katoa and malo alele for Tongan Language Week this week. Welcome everyone to this update today on progress in our Covid-19 response. I'm Andrew Old, Head of the Public Health Agency within the Ministry of Health, and I'm joined today by my colleagues Dr Pete Watson, the Interim National Medical Director of Te Whatu Ora Health New Zealand, and Dr Rawari McCree-Jansen, the Interim Chief Medical Officer for Te Aka Whai Ora, the Maori Health Authority. So welcome to you both and thank you for your time here today. So I'll begin with an assessment of the Covid-19 outbreak, where we're at in that to date, before handing over to Dr Watson for an update on how the health system is tracking as we move out of winter and into spring. Dr McCree-Jansen will then talk about what Covid-19 has taught all of us about how we can protect ourselves and our whānau from illness and some of the observations reported from our Maori health providers. I'll then wrap up with some final remarks before opening up for your questions. But first, the latest numbers. So today we are reporting 1,793 new community cases of Covid-19. There are 260 people in hospital, including 5 in intensive care and a further 6 Covid-19 related deaths. Reported cases and hospitalisations are now at the lowest levels that we have seen since February this year, at the beginning of our first Omicron wave. Taking a step back from today's reported numbers, our other Covid-19 surveillance tools, including those that don't rely on public self-reporting of results, are also showing clear evidence of a real and sustained decline in Covid-19 circulating in our community. Levels of the virus detected in wastewater across the country have continued to decline in the past week and have been dropping since mid-July. Case rates among healthcare workers have also been declining since mid-July and continue to do so across the region. Now, slides. Excellent. Thank you. There we go. I actually remembered to use the slides this time, so the media team will be very pleased with me. As you can see from the first slide, the 7-day rolling average of cases continues to trend downward across all regions, dropping 27% in the week to the 4th of September compared to the previous week. Importantly, this is true across all age groups. Moving to the next slide, this is hospitalisations, and you can see again that we have seen a decrease in the week to 28th of August in that 7-day rolling average, down 29% on the week before. Again, this is reflected across all ages, and importantly, those hospitalisation rates for those over 60 continue to decline, and that hospitalisation rates in our most vulnerable older age groups have the most noticeable declines. People in their 70s, about a 36% decline in the last week, and people over 80, a 35% decline. The number of deaths for people with Covid-19 are also declining. Just for some comparison for you, in the week ending 31 July, more than 220 people died with COVID, including almost 150 where Covid-19 was an underlying or contributing cause. In the week ending the 28th of August, there were just over 50 deaths of people with Covid-19, of which 35 had Covid-19 as a contributory or underlying cause. So, although those trends are really encouraging, it's important to remember that every death from Covid-19 is heartbreaking for those whānau who lose loved ones, and our thoughts and sympathies continue to be with them. I will now hand over to Dr Watson for an update on how our hospitals and the wider health sector are faring. Thank you, Pete.
Kia ora, Andrew, and nami mahana kia koutou katoa, and greetings everybody and welcome here to Middlemore Hospital. So yes, a sustained drop in Covid-19 case numbers with rates falling to their lowest point since February is certainly an encouraging trend. By each one of us doing the basics well and sticking to the public health measures, we have made a difference. This year, Covid-19 influenza, as well as the increase in other winter illnesses, has stretched capacity for healthcare, but we're now seeing some encouraging signs as spring is upon us. The rates of influenza illness, so the severe acute respiratory infections, are now at very low levels and the lowest since late July, following a peak in mid-June, with no cases detected here in the Auckland region in the week to the 28th of August. General practices continue to be busy, however, with volumes this week reduced slightly only on the week previously. Ambulance response times improved in the past week, with response time across urban and rural areas decreasing. Also, COVID-19 case numbers in aged residential care are now at their lowest, with only 234 cases currently since the outbreak earlier in the year. On these figures, on the latest figures, 1 in 9 facilities, that's ARC facilities, or 12% now are impacted by cases, which is a significant decrease on the 17% last week. Similarly, hospital bed numbers occupied by COVID-19 positive patients are declining, echoing a wider trend in the decreasing COVID-19 community cases. This shows progress is being made, and it's thanks to everyone doing their part and the hard work of the healthcare professionals in supporting patients and whānau through this period. I want to support all of my colleagues working both as service providers here in secondary care but also in primary and community care who are implementing their on-the-ground responses. We've had a national plan that continues to be nationally consistent, regionally led and locally managed. Pressures are now being addressed by focusing more on hospital flow, prioritising urgent care, but also increasing regional coordination to ensure equitable, accessible health system to achieve efficiencies across the system. We anticipate that as we progress through September and October, improvements will continue. These activities are also being accompanied by a consistent approach to performance monitoring so we can evaluate and improve and share successes, and this is happening now on a daily and weekly basis. So the health sector planned for a challenging winter, and we got that. But as a result of the planning, teams across the country have been able to work consistently to keep delivering. At the same time, the same people doing the planning and providing services were experiencing their own winter demand and the need for staff to isolate or care for their own whānau at that time. So while we do expect a continued long tail of COVID-19 cases, it's very, very encouraging to see the recent decline in cases is already flowing now through to a reduction in the number of severely ill people who require hospital-level care. This helps to ease the pressure on our system, and along with the cases of influenza and other winter respiratory illnesses also trending down. Te Whatu Ora will continue to coordinate activity through every network with one end goal, to look after our patients and to reduce pressure on our teams and staff. But of course, the health system can't do it alone. And so in closing, thank you to everybody for doing their part, keeping up the basic public health measures, continuing to support our collective effort, and as always, it's working together that makes a difference. Kia kaha, kia ora, katoa katoa. So thank you everybody, and now it's my pleasure to hand over to Rawiri. Kia ora, Rawiri.
Kia ora tātou katoa, tuatai ake me mihi au ki te mana whenua o tēnei wāhi, kei tāmiki tātou tēnei rangi. Tuarua me mihi hoki ki mō tēnei wiki o te reo o Tonga. Ka tira me mihi hoki ki ngā whānau ko pāngia nei ki te mate uruta e rere haere nei, me ki haere oti atu. Tēnā tātou. So, first of all, just wanted to say, it's really good to see the decline in numbers of COVID-19 cases that Dr. Old has described for us today. It's really important in terms of Māori because we have a higher rate of hospitalisations, we have a higher rate of mortality as a result of COVID-19. Just to make that really clear for you, the hospitalisation rate for COVID-19 for Māori is 2.3 times compared to non-Māori, and the mortality rate is 2 times the rate. So we I think, have to acknowledge all of those whānau who have suffered the loss of somebody during the pandemic. And I also acknowledge all of the work our Māori providers have contributed during the pandemic in terms of supporting patients and whānau and communities. It's important that we also acknowledge that Māori providers have done a really great job of supporting Māori communities. The public health measures that we talk about of social distancing and mask wearing and vaccinations have been a really important part of our total COVID response. And Māori providers have stepped up in terms of getting testing done, in terms of getting vaccinations done, in terms of providing manaaki and support for whānau. So this next stage that we're in, it's really important that we continue to do those things really well. If you have symptoms, please get a test, and if you could record that test, that'd be great. If you're not well, please stay at home. Please keep up to date with your vaccinations, and please use masks as appropriate. Just on the vaccinations, one closing point from me is the importance right now of getting busy with the measles, mumps, rubella immunisations. It's really low, it's deeply concerning, and to every extent possible, if primary care providers and communities could get really focused on lifting that immunisation rate, that'd be great. So, kia ora, and I'll hand back to Dr. Auld.
Thank you, Dr. McCree-Jensen, and I just want to take this opportunity to reinforce some of those points that Rawari has just made around please stay home if you're unwell and take a test. If you take a test, please record the result and make sure that you're up to date with your vaccinations, including boosters, because they are and still remain our most important protection against severe illness from COVID-19. So I'm going to finish today by looking at the latest modelling from COVID Modelling Aotearoa to give us a sense of where we have been this year and where we are heading. So we have a slide, which is this one, which shows the 7-day rolling average of cases against models. So the white line is the model, and the red line is how we're tracking against the model. So you can see that we actually, in this particular wave, had a lower and slightly earlier peak than the model predicted, but we are now, in terms of where we're tracking down, tracking pretty closely to that model. So you can see on this, because it goes back a little bit, we got the two peaks, the first one in March and then the larger one in July, but cases have now dropped substantially, and we are expecting them to continue to decline and level out in September. The same is true for hospitalisations, and given the variants currently circulating, which are now almost exclusively the BA5 variant, and rising levels of immunity in the community, which is both due to our high vaccination rate but also due to our significant exposure now to that particular variant, we're not expecting any significant rises in the coming weeks. Now, longer term, we know there will still be fluctuations in the level of COVID-19 circulating in our community, and we don't know exactly where this is going to plateau out. Things such as community immunity waning over time and the potential for new variants are both things that will affect how COVID-19 impacts the community in the future. So we haven't seen the last of it, and we do need to remain vigilant for a possible rise in cases, hospitalisations and deaths in the months ahead. Having said that, right now, we are clearly moving into a new stage of the pandemic, and I do want to thank everyone who has taken the steps in their own lives, from getting tested and isolating to getting vaccinated, to help us get to this point. But just to come back and reiterate that we are not out of the woods yet. We only have to look to the Northern Hemisphere recent summer experience to know that although the weather outside today is fine and we're definitely coming out of the worst of winter, COVID-19 unfortunately is not specifically a seasonal disease, and what will affect us here are the same sorts of things that have affected the Northern Hemisphere over their summer. So we do need to be mindful and vigilant of what may lie ahead. So with that in mind, and before we move to questions, I'd just like to preempt a couple because I know there's a lot of interest out there in the government's announcements next week about the future of the Covid-19 protection framework and associated Covid-19 protections. So the government will be considering that advice and then announcing its decisions, and so I'm not able today to preempt any of those, so I won't be able to say anything more about this apart from advising you to wait for the government announcements next week on most of those things. Having said that, myself and Doctors Watson and McCree-Jansen are happy to take questions.
What is the strategy around vaccination going forward at this stage? Are you going to keep rolling it out until we have a framework, or what's the plan?
Oh, it's a great question, which was about the future vaccine strategy. So that work is being done now. I would say that right now the focus is very much on getting people who are currently eligible for the existing vaccines through their first courses if they haven't been vaccinated to date, but particularly people who are eligible for boosters and second boosters, because those are our most vulnerable people, and we know that second boosters particularly are really effective in those groups at preventing serious impacts from Covid-19. Looking further ahead, people may be aware that there are new vaccines that are starting to come in over in the Northern Hemisphere. So none of those have been applied for in New Zealand yet, but we're obviously watching that very closely. And any future strategy will be determined a lot by what happens with future variants and the overall picture here. So that
people who have their second booster, elderly people might have had it a few months back now. I mean, what's your advice to them, or people who had the second one a while ago now?
So the first thing I would say is if you are eligible and you've had your second booster, thank you. That's exactly what we would like people to do. But at this stage there are no plans for third or subsequent boosters, but that work is actively under review. So we are, one of the things about our approach to COVID over the last 2.5 years has been a constant cycle of review, because really things keep changing. So variants change, the picture in the community of who's currently affected, the level of immunity, those sorts of things keep changing. So right now there are no plans for further boosters, but that work is actively being looked at.
What's your modelling telling you about what will happen in the summer?
Look, great question about what modelling is telling us about the future, and I would dearly love to have a crystal ball with a degree of accuracy, because as good as our modellers and their models are, the further out they get, the less accurate or predictable they can become. And there are a number of different scenarios that are playing into that at the moment. So if the current picture of variants stays the same, so we stick with predominantly BA5 circulating, then at this stage the models are suggesting that we would be likely to have a prolonged tail, which would hopefully get us at least to the beginning of summer and possibly through summer. But there are other models around that look at take into account the potential for waning immunity and also the potential for new variants over that time. So we have commissioned some specific modelling looking out both through summer but also taking us to the beginning of next winter, and hopefully that will be available shortly.
And one that shows the tailing immunity, what does that suggest?
So as I said, the further out you get, the less accurate these things get, and the number of caveats and variables, I suppose, that make a difference. So there are models that show a long tail sort of through summer, and there are models that show peaks at various points. So I think at the moment we'll sort of wait for that work to all be sort of peer reviewed and worked through, and then hopefully we'll have something slightly longer to be able to share.
I was so happy to account everything you're saying about the caveats and all that, but from what you've got so far, are they looking at like big peaks or sort of summer-sized peaks?
Yeah. So it does, the size of the peaks depends on the timing of the peaks and on the variants that we have circulating. So if we stuck with the current variant, then the earlier the peak, the lower it would likely be based on existing immunity and our experience to date, the later the higher. And so as I say, right at the moment, there's too many variables to give a clear picture, so I don't want to sort of provide any more information at the moment, just because, as I say, there's too many variables around what may or may not happen.
You did touch on earlier about the vaccines that have been approved in various countries overseas. Where are things at in terms of this, these
Yeah, so right at the moment, the manufacturers of those bivalent Omicron vaccines haven't applied to make them available yet in New Zealand, so our regulators are working and watching what's happening overseas and talking to the companies that produce those about those things. The good news again for New Zealand in terms of what we have been watching is that now that those are starting to be used overseas, we're going to get some we'll get some information about how effective they are compared to the existing vaccine that we're currently using. The good news is that the existing vaccine that we have in the country right now is very effective at preventing severe illness and death from COVID-19, so that's good news, and good news in terms of the current circulating variants. So exactly what additional benefit an alternate vaccine might provide for New Zealand is probably an unknown at this point, so that, but as I say, we're watching very closely the experience overseas.
What is the situation in the Northern Hemisphere at the moment? Obviously they're on a different cycle, they must be getting into winter, we're getting out of it. What do you draw from that in terms of how active COVID is there, but also that we're all starting to travel more, so there's more likelihood that we'll have infection here before it's happening?
Yeah, so I mean the Northern Hemisphere is a mixed picture. I think that's part of the challenge with all of this, is that different countries have had different experiences of COVID, and whilst that provides a sort of a great natural experiment in terms of looking at the different packages of measures that different countries have had in place which can help guide what we might or might not do, most countries in the Northern Hemisphere did experience a summer wave of COVID. In most cases those are now starting to come down, and they are starting to look at their pre-winter vaccination programs. So for example, we're looking this week at what the Netherlands is doing. They're starting up again a very proactive vaccination program to get themselves timed ahead of when they expect, as the weather gets colder, cases to start to rise again. So there's probably not a single sort of Northern Hemisphere picture, but there are multiple countries that we can look to for advice.
But does that suggest there'll be a summer wave here then?
No, not necessarily. Our winter wave has been a bit later than some of the Northern Hemisphere ones were, but also the big thing that drove the summer waves in Europe was the emergence of the new BA4 and BA5 Omicron variants. We have just had that, and so we're unlikely to get a big summer wave based on BA4 or BA5. There are some other variants out there, sort of people may have heard about BA2.75, BA4.6. Those at the moment don't appear to have a significant growth advantage or a significant severity advantage, that's probably the wrong word, over BA5, so we're not particularly worried about those. But as we saw with the emergence of BA5 initially, if we get the next variant, then that would change the picture here, depending on how much residual immunity our population would have, having had our waves of firstly BA2 back in February and then sort of BA5 more recently.
Do you know what the numbers are for that measles catch-up? How many, I think it was about 350,000 needed. Where are we at?
I'm sorry, I don't have the numbers for the measles catch-up. I don't know, but we can come back to you with that information, sorry.
Anecdotally, I've noticed, on public transport or in airports, supermarkets, there seems to be a lot more people who are choosing to not wear masks or wearing them kind of on their chin or under the nose. And I guess, was there any kind of message you would want to give to people who are choosing not to mask?
I mean, it's a great question about masks so a couple of comments I would make. Firstly, masks work at preventing respiratory infections, and they don't work if you wear them on your head or around your wrist or under your chin. So masks worn correctly are a really important tool to prevent the spread of respiratory infection. So that's the first thing. Second thing is, currently there are still places where you are required to wear masks, so it's timely to remind people that in a number of settings, including public transport, it is actually a legal requirement that people do wear masks, and that's in place to protect not only you from the people around you, but also it's protect other people. If you're potentially carrying something that you're not aware of. So right at the moment, masks still are very much an important part of our response.
And what is the likelihood of the second booster being opened up to everyone?
So good question. So our COVID vaccine technical advisory group has considered the question of broadening eligibility for the second booster. That advice is being finalised at the moment, and we'd hope to have some announcements about that quite shortly. What I would say is that the evidence for the current groups is very strong. The evidence for the benefit of widening that is not as clear, which is just why it's taking a little bit longer to work through whether that is something that we would more proactively recommend.
Did we have any other questions, folks, for other clinicians? Mindful of time.
Yeah.
I did more about the planned care.
And I have added a few to what I'm doing as well.
Yep. Hi, just wondering where the hospitals are at in terms of planned care now, how much has moved, and if you could be as specific as possible, that would be great.
Sure. So, as everyone will be aware, planned care has been something that during COVID we lost ground on, and that's been across the system. So we've been aware of that. We've had the planned care task force working hard to actually help support how we can start to address that. That work has not yet quite completed, so we're all awaiting the landing of that piece of work from Dr. Connolly and the task force. But we also know that one of the first points or the first areas to address was long waiters. So those patients who've been waiting more than 365 days for non-urgent planned care. And that's been the first point. And all of the districts have been working really hard to ensure that those people are scheduled for their appointment. That information is still currently being collated. We expect that to be available the middle of this month, but we are really confident that not only has that given us greater insights into actually what we're looking at and how the system needs to respond, but that we are making good progress on that. But we'll be able to come back with some numbers in the not too distant future.
And this in terms of the COVID impact, you know how there was some that hospitals only doing the most urgent cases.
Sure.
What's happening with that?
So one of the really rate limiting things has been staff illness, and as I talked about, the staff have been impacted just as the community have, so directly been unwell with COVID, influenza, but also their whānau members and having to stay home. So we know as that's waning, that's increasing our capability, and so as I mentioned, the pressure on the system has started to ease, so everywhere is able to, on a day by day, week by week, do as much planned care as they can. So that is starting to increase across the system. But it still varies, just depends on what's happening in a particular site on a particular day. But yes, that is started to be able to be increased again.
Are there any particular areas where there's still pressure you were saying it's there?
Look, I don't think so either in terms of no areas doing particularly worse than others. I think there's a range clearly. But we do know in terms of the types of planned care, the volumes are the same as they've always been. So we know, for instance, orthopaedics, there's a large number of planned care in orthopaedics, and that is still the case. But in terms of geographically, we'll have a much better sense of that when we've collated all of that information, but there is a range of capacity across the system, but we'll be looking to support that regionally and nationally about how we can address and support everywhere, being able to make good progress on that.
What's your understanding of the delivery of cancer treatments currently and through?
So cancer treatment has always been prioritised. So that has been part of what's been the expectation, and as far as I'm aware, pretty much we have ensured that we've done time-sensitive treatment right through our response. So we prioritise, which means we put off or deferred non-urgent treatment, but cancer treatment's been right up there. So that's been prioritised. I guess one of the areas has been the screening, which has definitely been something that's been impacted. And so again, we're starting to now focus on those areas of cancer screening, which may have been impacted through the COVID, again, because of the impact of staff on staff and getting that back to where we need to be and making back up that people who haven't been screened during that period of time.
Would you expect to know if any areas have not been carrying out time-sensitive cancer care?
Currently, if that's been the case, we would expect to know, because we're trying, as we've been talking about, to now keep a national view through Te Whatuora and the consolidation of the DHBs into Te Whatuora to have a much better view over the entire system, so to be able to understand where planned care is not happening, we expect to be able to have a good view of that.
And are you aware whether any patients have had to move from one region to other regions?
So plan care is being offered in different regions for people, from the old district health board boundaries across boundaries. So care is being provided now across boundaries of those old DHBs to support plan care capacity. In one area where there's a large waiting list to an area which has a capacity that is underway in some areas.
What about the cancer treatment?
I can't answer that specifically for cancer beyond what has been done previously.
Got a couple of minutes here, folks. Questions for Jason?
Just going to start with Māori TV, I think.
Tēnā koe. E mihi ana ki a koe o tina kia kōrero ka puto mai anō hoki. No reira, COVID cases have dropped to 1,000 or 2,000 a day. Is it all over?
No, it's not over. COVID's not done with us yet. We've got a long tail in front of us. The modelling that we saw today kind of gives us a sense of where it's heading to. And, there's a number of variables that Dr. Old was talking about we're not sure about. We don't know, will there be a different variant and so on. So we've still got to be vigilant. We've still got lots of work to do. And then as Dr. Watson was talking about, there's a whole lot of things have been interrupted during COVID, and we've got to get busy and get that back on track. So the planned care work's really important. So it's not over.
So should we just learn to live with it now?
I think we have done a really good job of managing it and reducing our risks and protecting whānau and protecting communities. We still need to do that.
Tēnā koe. Will the pandemic planning be aware of Māori, our vulnerability and ability to reach our communities, especially our whānau and our whānau is done in our rural communities?
Yeah, it's been one of the really big challenges is how we support communities, and that's true in South Auckland and the great job that Māori providers and our health teams have done to support communities here. It's true in the rural and distant locations from North Cape to East Cape, all over the country. There's been, really massive effort to look after Māori communities. I'm keen that we carry on doing a great job of that.
Tēnā koe.
Kia ora. Ngā mihi.
Yeah, sorry, I just wondered if we go over the comparative rates. I got 2.3 times more hospitalisations than I did just in the mortality rate.
Yeah, and 2 times the death rate for Māori. That's age adjusted. So, you've got to get the statisticians to have a look at our population. We are getting more serious impacts from COVID at a younger age. So it's really important to understand all of those things. But overall, it's true that we are more impacted by COVID than other populations.
What's your worry about the measles? What do you think could happen if that campaign to catch up people doesn't pick up pace?
Well, the interruption that we have to health services due to COVID comes on top of a long-standing issue in terms of underperforming for Māori. We don't want to go back to that. So we've got to get busy and address everything that was delayed or deferred or missing, and we've got to get our system actually performing really well for Māori. And that's, Te Ako Whaiora is committed to working with Te Whatu Ora and Te Manatū Hauora to achieve that.
In terms of the measles, is it an outbreak that you're worried about? Look out the catch-up, how we're behind in the catch-up campaign and also immunisation reporting?
So there's always going to be a number of features. I think we will give wrong answers if we want to give simple answers. So let's acknowledge the complexity of the healthcare system and all of those things, as well as COVID internationally and how that affects our ability to serve our community. But we've got to be really clear in our intention to serve our community, and I think that's our commitment in terms of equity.
What does the COVID landscape look like for Māori?
So right now we can see some good tracking in terms of the numbers of cases. We're seeing reductions in hospitalisations, and so that's really important for our community. We are seeing still quite a lot of whānau affected by having to isolate and so on. So we've got to look after our whānau, support them to be able to isolate safely, and then we've got quite a lot of our whānau who will be eligible for the COVID therapeutics, and so we want to make sure that they get access to those when they're eligible. So it's still a busy place for us, yeah.
In terms of your work in the
Oh, we've got one more question, is it?
Yeah.
Okay.
Thanks, Ron. Just in terms of your work, working in the community and the impact of the delays to planned care already existing but compounded by COVID, like the SARS outbreak, what are you seeing, what impacts are you seeing in the community?
Dr. Pete Watson mentioned the impact in terms of screening, and I think we could be mindful of the numbers of missing cervical screens. And we can see it's in excess of 50,000 screens missing or delayed, so we've got to get busy and do as many of those as we can. But it's predictable from that we will see an increase in terms of cervical cancer. And so we've got to be really organised to meet that need and to deliver services that meet the needs of our community. Having said that, we've got some work to do to actually introduce the new HPV self-swabbing program. That will be really important. So the complexity is we've got to do both things. We've got to get ready for the new screening program, and we've got to meet the missing, delayed, deferred part from the COVID outbreaks. It's a busy time. The health system is feeling the stress of the outbreaks and is committed to serving our communities. I'll hand back to Dr. Old.
Anything you guys all good? Anything further? Good. Okay, thanks guys. Thank you very much.
Thank you.